Good morning and welcome to our second day of this year's Pflugerville Seniors Conference. My name is Rob Fabian with Age of Central Texas, and along with our partners over at the Pflugerville Community Church, we are so glad to be bringing you this fifth annual Pflugerville Seniors Conference. You know, for those of you who've been attending our conferences in the past, you know that we were originally scheduled to have our conference in May, but the coronavirus had other plans for us, and so we had to cancel. But we didn't want to lose the opportunity to bring to you these amazing speakers that we had already scheduled for the conference. So we decided that we would go virtual. And this is our first time in presenting this conference virtually. So we're kind of learning as we go. So if along the way today we have a couple of little hiccups, please forgive us. But we are so glad that you're going to be with us today because we have an amazing program. We're going to be talking about COVID and about what we know and what we don't know. So we're very excited to have Dr. Mary Theoctisto with us today. She is with Baylor Scott & White Health, and we're going to have a great conversation. Before we get started though, got a couple of things we want to do. Number one, I want to show you a very quick video from one of our sponsors. We are very thankful for all of our sponsors who've helped us underwrite the cost of presenting today's program and this entire week's program so that we're able to provide those to you for free. Then we're going to come back and we're going to do a little bit of housekeeping. So wanted to show you this quick video from the folks over at the Senior Resource Guide. All right, we want to thank the Senior Resource Guide and all of our sponsors for helping us make today possible. We also want to thank very much Baylor Scott & White Health for being our presenting sponsor for this year's conference and for making today and our whole week's worth of presentations possible. Before we get started, a couple of real quick housekeeping. Number one, we are recording this session. So if for any reason you have an issue on your side with your internet connection or you get knocked out of the conference, don't worry. We're going to be posting today's presentation to our YouTube channel, and it should be available later on today. At the end of the week, we will send you a link of all the presentations and all of those videos for the entire week. At the end of the week, we're also going to send you a survey, and we hope that you would fill that out and return it to us electronically, because that will help us in planning for next year's conference. We want to know, what do you want in terms of presentations? What is most important for you in your journey right now? So give us that information, let us know that feedback, and I promise you, we read every single survey that we receive, and we use that information to plan for next year's conference. Speaking of things that were sent to you, when we sent you the reminder link for this presentation, we also included a link to the program for the conference. We hope that you will take a look at that. It not only has information on all of our speakers with their bios, it has information from all of our sponsors with a lot of great info there, but we also sent you a lot of community resources. So be sure and take a look at the program, because there's a lot of great information in there. Finally, you have a chat feature here on Zoom. It's right down here at the bottom of your screen. It looks like one of those thought bubbles that you see on the comic strips. Click on that, because we want you to ask questions during our presentation today. Because, again, we are doing this for you. We want you to have the opportunity to ask all of your questions and have them answered by a healthcare professional, and have that happen live here today while you have that opportunity. So be sure and ask your questions. At the end of the presentation, we're going to go back and we're going to go through all the questions, and we're going to answer them for you. Now, we are a little limited on our time, and so we are going to honor the time frame that we gave you. So if for some reason we have more questions than we have time today, don't worry, we're still going to answer your question. If we run out of time to answer all the questions live, then we are going to send you an email and answer your question directly. All right, so that takes care of all of our housekeeping. So let's get started. We are very excited to have Dr. Mary Theoctisto with us this morning. She attended the medical school at St. George's University School of Medicine in True Blue, Grenada, West Indies, and completed her residency at the University of Texas, right here at the Dell Medical Center, as a physician resident in internal medicine. She also holds a residency at the University of Texas Health Science Center in San Antonio as a clinical fellow in infectious disease, and she is a member of the IDSA Texas Medical Society, where she specializes in infectious diseases. So we have an amazing expert here for us today. Dr. Theoctisto also enjoys taking time to educate her patients on their particular diseases and the disease process, because she wants to help them achieve their health goals. She says her passion for infectious disease and for public health means that she is always looking to help her community heal. Dr. Theoctisto, we thank you so much for joining us this morning. I am going to turn our presentation over to you. So if you want to join us and unmute, and we are so excited to have you with us. I'm going to let you take over the presentation.
Thank you. Okay, I have a PowerPoint I made. So let me see if I can share my screen. Oops. Here. Okay. Just bear with me for a moment. I'm not the best at Zoom. Okay, can you guys see it okay, Rob?
That is perfect.
Okay, all right. So I made this PowerPoint, and I wanted to kind of target it to what's going on here and then our age group. And so I have some updates. Some of it you guys will know. I'm a big fan in repetition, so you're going to hear it again from me. And then some of it, I hope I'm teaching you something new. I kind of a little brief COVID update, kind of what's going on right now. We're going to talk a little bit more about transmission and prevention. There's a lot of holidays coming up, so I thought we'd talk a little bit about travel, if we should travel. It's flu season, so COVID and flu, they're very similar in their presenting symptoms, so we'll touch on that. And then kind of what's going on in current events. What are our treatment options? Are there vaccines? When are they going to be available? And a lot of people like this question, do we have immunity? And then I'll take some questions. So I looked this up yesterday. These are as close as I can get to current numbers, just targeting the United States. So far, there's been 7.7 million cases, over 200,000 deaths. And interestingly, Texas in the last week has had the most number of new cases. So that's something we need to be aware of. I wanted to point out these two graphs here. You see the one in red, and this is the burden of disease by age group. And so when you look at it, you can see kind of the bell curve is a little lower for 18 to 29-year-olds is probably the highest burden. And so you'll see that the burden of disease is actually in the younger folks. But then when you go and you compare what's going on with mortality and deaths, the blue curve shows you that as you get older, you have an increased risk of death, with the highest risk being over 85, and that's about 31%. So it's pretty high. So, you know, there's been a lot of questions and kind of why are elderly people more likely to get severe disease and have higher risk of mortality? And so there's kind of a lot of factors that go into this. The main thing that we think is that as we get older, we have more comorbidities, so more likely to have other things wrong with us, like high blood pressure, kidney disease, diabetes. And then as we get older, there's this concept of immunosenescence, and that's kind of where our immune systems naturally get weaker with time. And so when you have a combination of all these things, it seems like you're more likely to develop what we call a cytokine storm, and that's where our immune system and all these inflammatory processes make us more sicker, and this results in the life-threatening respiratory illnesses. So people getting really sick and needing ventilators and life support. There's also some thought, there's a lot of data out there, we're still learning, so a lot of this we'll probably find out much, much later what actually causes a more severe disease, but it seems like aging, as you age, we do have a decrease in clearing the viral particles, and so if you have a decrease in clearing viral particles from your airway, you'll probably be sicker longer. I like images, I'm a visual learner. So I found this nice table from the CDC, and it's just showing you how likely you're going to be hospitalized based on what your underlying comorbidities are. And so when you look, you know, they include respiratory illnesses, so asthma is included. If you have high blood pressure, you're 3 more times likely to be hospitalized. If you have obesity, 3 more times, diabetes, chronic kidney disease. If you have 2 or more conditions, 2 or more comorbidities, you're 4.5 times more likely to get hospitalized. And when you're hospitalized, that means you have severe disease. You're needing oxygen and you're needing intervention and therapies. And so if you have 3 or more comorbidities, even higher risk of having severe disease and hospitalizations. This is another way to look at it, and it compares age group in the yellow bar at the top by hospitalization risk and then risk of death. And so you can see, and we know from earlier that our burden of disease was mostly in the 18 to 29-year-olds, so that's going to be our comparison group. And compared to the 18 to 29-year-olds, as you get older, you have increased likelihood of being hospitalized. So people who are over 65, 5 times more likely compared to our comparator group. And if you're 85 or higher, 13 more times likely to be hospitalized. And you can see compared to the comparator group in this bottom row here, as you get older, you have a much, much higher risk of death. So we'll go over symptoms. We've all heard these. I think we're all experts in these, but it's worth talking about again. The symptoms are actually, they vary, and they're very common to all of the common respiratory viruses. So fevers, chills, cough, shortness of breath, allergies can look like this too. You can get muscle aches and pains. The one thing that's kind of unique to this virus is the loss of taste or smell. Sometimes people just have alterations in their taste. So they might not lose completely their taste, but they may have different tastes, like things are very, very salty is what I hear a lot. And then you can get a lot of congestion, sore throat, and then you do get a lot of GI symptoms, diarrhea, nausea, vomiting, abdominal pain. And these symptoms generally occur somewhere between 2 and 14 days from exposure, and of course they can vary from very asymptomatic, very mild, to severe. I wanted to compare it to the flu since it's now flu season. And as you can see, the flu has very similar symptoms, almost identical. So you do get fever and chills, you get cough, you get shortness of breath, runny nose, muscle and body aches, headaches, fatigue, and you get GI symptoms of the flu too. So you will get nausea and vomiting and diarrhea in some cases. So it's just something to be aware of, especially as we are in flu season now. We all know this. Transmission is spread primarily through respiratory droplets, but we do think it can be airborne in certain situations. And those situations, we believe, are crowded, poorly ventilated places where the loud talking, yelling, and singing occurs. And so examples like that would be crowded bars, crowded restaurants. There have been high transmission cases in choir practice, which leads me to this nice infographic where it shows this one symptomatic person in red spread it to 87% of his choir practice group. And so it just highlights incredibly the importance of staying 6 feet or more away from somebody and wearing face masks, especially if you're going to be in an area where airborne transmission is higher risk. You got to wear your face mask. And so we know how to protect ourselves. The news, we're all being experts in COVID as the year progresses. We're all learning, but this stuff we've known from the beginning. Wash your hands, social distancing, avoid close contact if you can, wear a mask, clean and disinfect frequently touch surfaces. So I clean my steering wheel a lot, my phone, I think people forget about their phones, the countertops, just things you're touching a lot, they should be cleaned frequently. And then of course, monitoring your health. I put this little guy in the corner because you should not cough into your hand, cough into the mask, cough into your elbow, but don't cough into your hand because then you might touch something before you wash it. Or if you cough into your hand, go wash your hands. This is another infographic that highlights the importance of wearing a mask. And so these are 2 hairstylists that were symptomatic or pre-symptomatic, and they wore a mask, and it's probably a poorly ventilated area because it's a salon, and they together had a combined 139 clients. None of their clients got COVID because everybody wore a mask. So that just is emphasizing the importance of wearing a mask and protecting yourself. So, it's hard to know what to do during all this holiday season, especially now we're seeing an increase in numbers again. So you really need to think about it, kind of where are you going, who are you going to visit, is there a lot of COVID in the destination you're trying to travel to, how are you going to travel there, are there restrictions in that state or country that you're thinking about going to. If you had asked me this question, if I thought maybe traveling during a holiday was a good idea a couple weeks ago when our numbers were a lot lower, I might have said maybe, but right now with this huge increase in our numbers, if it's still going on quite a bit for Thanksgiving and Christmas, I would think very strongly about not traveling. So those are things to think about, and you really need to kind of put your own, whatever is going on in your life into context and where you're traveling, and just kind of think very critically about it and if it's the right thing to do for you or not. So it's worth mentioning vaccines. There's a lot. There's over 100 in development worldwide, which is crazy. There at least are about 43 of them in clinical trials. And the clinical trials, is important to know that that's where we find out if the vaccine works. And then as the clinical trials go through different phases, that's when you find out if it's safe to give as well. So the 3 you may have seen in the news that are in phase 3 trials are AstraZeneca, Pfizer, and Moderna. I don't know when they'll be available and how efficacious they are. AstraZeneca halted their trial recently. I don't know where they are with that. But we do anticipate the first available vaccines to be maybe sometime at the end of this year or early 2021. Honestly, if you're thinking about mass production and you're waiting on phase 3 trial results, it's probably not going to be till 2021. There's also been in the news the Russian and Chinese vaccines, but it's important to know neither of them completed phase 3 trials, so we don't know if they work. Just to mention that. They're not available here. There's no direct active therapy for COVID yet, so there's no cure. These are the treatments we have been using. There's also some other ones that I didn't mention because I don't know as much about them because they're all clinical trials at sites that I was not involved in. But we do know steroids seem to help, and they seem to help kind of calm that cytokine storm, that big inflammatory process that I mentioned earlier, and that's kind of where people get into trouble. You do have to be kind of careful when you give steroids, because if you give it too early in a disease course, it can prolong shedding and maybe possibly prolong the viral illness. Plasma is something you may have heard about. That's when you give somebody else's blood product, so basically essentially their antibodies, and you're hoping that giving them antibodies from somebody who's had COVID and has positive antibodies helps the person that's sick. We don't know if this works yet, but it's something we have been giving. Remdesivir is an IV antiviral therapy that was developed for a different virus, and it didn't work for that one. And it has been used, and it has some good data to show that it may help get people better quicker. And these have to be hospitalized patients that we give it to because it is only IV through the vein. And so there's certain criteria that people have to meet to receive this medication. And then there's exclusion criteria as well because it can be toxic in certain ways. So it only is given in a hospital. And then there's a whole bunch of different other drugs that are currently being studied for efficacy. These are still being studied as we speak, and when we should be giving things as well. What is the best timing for efficacy? So this is kind of, being determined, how, this was a question at the very beginning, I remember, if we get COVID, how long is our immunity? And so the short answer, it's lasting immunity is still being determined, but it does appear that our antibodies that are detectable, they wane after a few months post-infection. And in fact, if you have mild or asymptomatic disease, you may not even develop antibodies. It has been shown that people with severe disease have a stronger immune response. This makes sense. And so they have higher antibody levels. These may last longer, we don't know. Reinfection has certainly been reported. And therefore, with kind of all the current data and things that we know right now, we think that immunity may last 3 months. Could be longer, could be shorter. So we're not 100% sure, but this is still information that is coming out and it's being studied. And so since I keep mentioning the flu, really there's only one main thing to do for flu season, and that's get your flu shot. And then it's a respiratory virus, so keep doing what you're doing. Wear your mask, social distance. Just be cognizant of indoor activities, especially during the COVID months as this pandemic continues, and now we're in, flu season. So just, be very cognizant about your activities, continue to social distance, continue to wear your mask, and I strongly recommend obtaining your flu shot. And so that is it for my PowerPoint. So I will stop sharing my screen and go over to questions.
Thank you so very much. That's some great information. This is your chance, guys. Ask your questions. We're going to take just this much time. I've got one more video I want to show you real quick. It's from Baylor Scott & White, who is our presenting sponsor today. And they have got some great information here about their healthcare currently during COVID.
At Baylor Scott & White Health, there's nothing more important to us than your well-being. Over the last several weeks, we've done a number of modifications to our emergency room so you can continue to get the care you need when you need it. We're regularly cleaning and disinfecting frequently touched surfaces in our lobbies and patient areas. When you arrive, a screener will check your temperature, and we're requiring everyone to wear masks. When it comes to registration, we've got a no-touch process. You just answer a few simple questions. We'll get you back to a room as quickly as possible. We want you to be well informed and not ignore symptoms that could indicate a potentially serious condition. In those situations, it's critical you don't delay. To learn more about all we're doing to help keep you safe, visit bswhealth.com/safecare.
So, Dr. Theoctisto, want to ask you real quick, is it now safe for us to go back and see our doctors at the clinics or to have that elective surgery that we may have been putting off, but we know that we need. Where are we right now with that here in Central Texas?
So I think it's, at least at Baylor Sun and White, it's fairly safe. If you're screened at the door. And so if you have any COVID symptoms, and really if you have COVID symptoms, don't come in, call your doctor, and you can always do a video visit, or call and say, hey, I have these symptoms, and we can work you up. So at least in that sense, if you're screening at the door and everyone is wearing a mask and the waiting rooms are well distanced, I think it's safe. And you certainly don't want your care to lax, because that's when you're going to run into even more problems. I believe with elective surgeries, we are screening for COVID preoperatively, so we know what to do and take the appropriate precautions when you're in the operating room.
Awesome. Yeah, and telemedicine is always available as an option. So that's really right now, I think, your safest bet. But if you really need to go and see your doctor, then go see your doctor. Don't put things off, because I think we've heard this time and time again, that if you put it off, you're running yourself at higher risk of more issues. You don't want to add to those comorbidities that might cause you to be at greater risk for the COVID. Gloria says that as a grandparent, I'm not sure how much or how close I can safely be around my grandchildren. I'm especially worried now that they've started athletic activities, but I sure do miss them. For grandparents, we know that right now we're seeing a big uptick in cases with young people, especially since they've started school again and they're having their extracurricular activities. As grandparents, how can we still interact with our grandchildren, but do that safely? What kind of advice would you have?
Yeah, that's hard, right? I miss my parents a lot too. I haven't seen them in a long time, but, I don't think you can safely hug someone, especially, when kids are in and out of daycare and in and out of school. They're probably not going to be symptomatic. Maybe if you're in the same room and you're wearing a mask and it's not crowded, or you're outside and it's ventilated, but really you've got to wear a mask, and you just have to, you have to stay distant. And that's really the only safe answer. There's not another safe answer, unfortunately.
We know that there are so many unknowns about the disease still. I was having a conversation with my parents, and they grew up during the polio epidemic. And in fact, my mother's best friend in school developed polio. And so my mother and father were telling me about what they went through during the polio epidemic. So they said for them, the social distancing and staying at home is nothing brand new to them. Right. And I'm sure for a lot of folks that are joining us today, this is just version 2 of what you went through as kids. But at the time, there were so many unknowns about polio. We didn't know how it spread, and people were terrified because it was affecting children and didn't know how it was happening. We've got a lot of the same scare now, but on the other end of the scale, this is affecting older adults, yet there's so many unknowns that we still don't have. So I agree with you. I think our best bet is wear a mask. That's the one thing we know that does work. And so that's where we need to go. Got a question specifically about masks, and it is, if we have friends who say, oh, I'm not going to wear a mask, I don't have to wear a mask. Is there any logical, smart way to have that conversation with them about you need to wear a mask?
I showed you the data. Wearing a mask, we're not reinventing the wheel with this recommendation. People were masks during the Spanish flu in 1918. So we're not reinventing the wheel. We know this works. And unfortunately, I don't know what to say to those people, but the science is there, the data is there. And so I think all we can really do is just strongly encourage people to wear a mask, and everybody can do their part in wearing a mask as well, and just socially distancing.
Yeah, just share with love. About all we can do, but take care, but protect ourselves. Correct. Most importantly. Zora wants to know, does sleep apnea put you at greater risk for COVID-19?
I don't think so. That's, I think, a little unknown, but keep wearing your sleep apnea machine, because that'll help you.
And, we were talking about risk factors, and I think now, since we are spending a lot of time at home, we have a lot of free time on our hands, it's a great time to really reassess our own personal health and start looking at what are the risk factors that we might have individually that could affect us being susceptible not only to COVID, but to flu and everything else that comes down the pike. I want to give a shout out to our partners over at the Pflugerville Community Church, because they have an amazing seniors exercise program that happens every week. It's absolutely free. And when you go and look in your program, in the resources that we sent you, there's a flyer in there about that. I urge you to take advantage of that because it's a great opportunity. Steve, who runs the program, always brings in guest speakers to talk about your health. And I know that a lot of the medical professionals over at the Baylor Scott and White Health Center in Pflugerville have gone and spoken at a lot of these gatherings. And also the health center there in Pflugerville does have a lot of free health activities as well. So contact them for those. Every opportunity that you have to make yourself healthy, especially during this time, I think is really important. Wanted to ask you a question on something that you touched on, which was allergies. And, that's kind of year-round here in Central Texas, but right now we're dealing with ragweed and pigweed, and dust blew in this week, and we're getting ready for the fires and the ash and everything else that happens this time of year. Since COVID and allergies have a lot of kind of the same symptoms, what's kind of our good rule of thumb on, okay, this is just my allergies, or this is something I need to take seriously?
Yeah, so, there are some fevers with allergies, like cedar fever. Sometimes people with hay fever, they can as well. But generally, the rest of the allergies shouldn't cause fevers and chills. With some caveats there. The changes in your taste and smell, allergies shouldn't do that unless, of course, you're getting a sinus infection and then your nose is all plugged up. But usually people who have changes in their taste and smell, it's both. It's not just one or the other. Generally, it seems to be both, although I'm sure there are exceptions to that rule. And then you shouldn't get GI symptoms. And so I will see a lot of people coming in that'll just have diarrhea first, and then they'll develop the respiratory symptoms a little bit later. So I think it's kind of important to pay attention to the GI symptoms.
Excellent.
Yeah, but that is the question of the year. Is this allergies or is it COVID?
Yeah. And, flu season is right on top of us. We've been really encouraging, go get your flu shot. There was some data that came out a couple weeks ago that the suspicion that having a flu shot can give you some protection toward COVID. Have you heard anything more about that information? It just kind of, appeared in the news and disappeared.
Yeah, I don't know. They're completely different viruses. So remember, COVID is a coronavirus and an influenza is an influenza virus. So they're completely different. And the flu vaccine is made for what we predict will be the most predominant strain of influenza for that season. So I don't see how the flu vaccine would work for COVID, but it will certainly help protect you from the flu. And you don't want to get sick with both. You're going to be in trouble. So we have a good vaccine for one, so let's use it.
Right. Yeah. And certainly flu is nothing to mess with, especially when you're talking about older adults. And flu can be absolutely deadly for older adults. Is that not right?
That's correct.
Yeah. So no matter what, whether it protects you from coronavirus or not, go get your flu shot. Is this a good time to get the flu shot? We always hear wait until November because of the time period that it takes for the immunity to kick in. Should we do it right now? What do you think?
Yeah, the best data is getting it at the end of September, beginning of October. So now's the time to do it. And, and then usually it'll last you most of the season. But if it looks like the season is extending, you can always get revaccinated.
That's great advice. And then also there are two flu vaccines that are available. There's the regular, and then there is the one that is recommended for those who are 65 and older.
The 65 and older is just a higher dose, and that's because it goes back to our aging immunity. As we get older, we may not mount a good enough immune response to develop antibodies. So that's why the higher dose one is recommended for ages 65 and older.
Excellent. Got a question about, with Thanksgiving coming up, wanting to know if the rapid tests are available or will be available to those who plan to gather in small groups? And if they are, can the general public access those?
A good question. It's a good idea, right? I don't think they're available in that capacity use through Baylor. There are other entities in the Austin area, and I don't know the names of them, that they may be available. My one caveat to rapid tests are know what you're getting. Antigen tests are not as good. And rapid PCRs are less sensitive. And so just be aware that even if you have a negative test, you could develop symptoms a few days later. So just be aware that, I think it's a good idea. Everybody gets tested. Hey, can we hang out? Your risk is probably a lot lower because you're going to catch the asymptomatic people, right? But know that they're not perfect.
So the testing that we have available here in Central Texas, that is what type of test?
They're generally, most of them are the PCR tests, and that's where they stick the swab up your nose, and those are the best ones.
And how long does it take for the results to come back on those?
Those come in pretty quick. So the rapid testing, depending on where you get it done, can be within the same day or within hours. It just honestly depends on the volume at the lab and where you're doing it, and if it needs to be sent to offsite or not. And then the more sensitive PCRs do take a little longer. This can be a day or two. It, again, just depends on lab volume and flow and where you're doing it.
So speaking of lab volume, we've been hearing the possibility of an uptick coming in November, December, especially after having the holidays that we had this summer and now school and the kids are back face to face and all of that. What are you hearing as far as the potential for upticks here in Central Texas later in this year?
I probably will believe it if that happens, but I get it. It's hard to stay home and not see your family and do things. So I just caution people to think very strongly about what they're doing and where they're going and how they're approaching being safe, especially in the holiday seasons. But I'm sure it'll go up again, especially, with the colder months coming on. People are going to be spending more time indoors. It'll be more crowded indoors. So that plays a huge factor in that as well.
So with the holidays coming up, I know a lot of people are really missing seeing their families, and a lot of people are really debating on, should we all get together for Thanksgiving around the table? Should we have the Christmas celebration? Should we make that trip to go see the grandkids?
Yep.
I know it's not a one-size-fits-all answer, but do you think it's a good idea, or would you recommend, considering that most of us who are in that boat are going to be 55 and older?
Yeah.
Should we take the risk, or should we have a Zoom Thanksgiving?
I know. The short answer is probably not. The longer answer, thinking about where you're going and who your family is and what part of your family you're seeing and what the destination is and what do COVID numbers look like at that time is another way to approach it. I'm having the same debate myself internally, and with the new increase in numbers, I'm probably going to cancel my plans. I don't want to.
Yeah, it's a hard thing to try to decide, but when it boils down to, are you risking your life?
And yeah.
Or potentially risking the life of your loved ones.
Exactly.
As you mentioned, Texas still has some of the highest numbers in the nation, and Central Texas is a very active area. Even though our numbers right now are not very high, we have a lot of people who come to Central Texas from other parts of Texas who could be bringing the virus in, and we won't know those numbers for several weeks.
Yeah.
So it's, I understand it's a big risk factor, but I agree that, looking at where you're going, know what the numbers are there. That's something you can always check. The CDC has daily running tally, so you can look that up online and see what numbers look like in particular areas.
And local health departments are a good resource as well.
A question, and it may not be one that you can answer, but a lot of people have been questioning whether or not they should fly and the safety of being in an airplane.
So, airplanes, you know, you don't want to sit right next to somebody. I'll just say that. So if they're crowded, I probably wouldn't recommend that. But the interesting things about airplanes are they do circulate air with the outside air very frequently. So you do have air changes. And then there's good kind of ambient flow. You know, it's cold in there. You know, it's like windy. I don't think that's the right term, but the air circulates, right? So that risk, the risk is there. It's probably lower than we think. I do believe the risk is much higher in the airports. Okay, when you look at, there's some data out there, and I will include it next time I give a talk like this in my slides, but they have looked at where our risk is higher in obtaining COVID. Of course, gyms and bars are like at the very top there, but airports are very high too, and that's because airports themselves are crowded. People are spending a long period of time during layovers. They take off their masks because they're eating and they're talking and they're drinking, and the ventilation isn't there. So that would be my answer. So no, probably not that safe.
Yeah, that's something I had not thought about. Is the waiting time, because you've got a good hour and a half, 2 hours that you're there right next to everybody else in that small area. So it's not necessarily the plane, it's the airport.
Right. There is risk in the planes,
yeah.
But I think airports are higher risk.
Yeah, that's a very good point. Really great information there. We've got a few more minutes. If you have other questions that you'd like to ask, please type them into the chat box, and we will certainly answer your questions, because this is your opportunity to have an expert right here and get all of your questions answered for you. We know that we're seeing a lot of uptick in the younger folks, mainly because of extracurricular activities. As grandparents, are there things that we can do that we can still be active with our grandkids, but protect ourselves? Obviously, we want to wear our masks anytime we're around them. Any good advice there other than Zoom is always your best bet?
Yeah, Zoom is always your best bet. You know, maybe there's some lower risk if you're doing an outdoor activity and there's not a whole crowd of you and you're washing your hands and wearing your mask as best as you can. And now that it's not so hot out, it's not as terrible wearing your mask outside either. You know, I know some kids don't like to wear masks, but my 4-year-old and 3-year-old nephews have no problem wearing their masks. So just ask, you know, do what you can there. So that's safest answer, Zoom, of course, is always from my standpoint, but mitigate your risk where you can.
Yeah, with younger kids, it's easy to make it into a game, and they like playing where they can participate. I know one of the issues that we've seen a lot is, especially here in Central Texas, we have a lot of grandparents who are actually raising their grandkids. And so you've got two major risks in the same household. So I know you had mentioned earlier, the big things we need to remember is the same things that we were told from the very beginning. Wear your mask, wash your hands, because you don't think about things like when you go pick up that to-go order and you sign the receipt, how many other people touched that pen?
Oh, yeah.
And and then you get back and then you grab the steering wheel and your phone, and now you have spread it to things that you're going to touch 5, 6, 7 more times during the day.
So I carry my own pen around, and I will not use anybody else's pen.
Yeah.
I strongly suggest everybody do that as well. Just carry one around, and if somebody offers you a pen, you go, I have my own.
Right. And the hand gel disinfectants as well. We've heard a lot on how effective different brands are of that. Is for the disinfectant, is there some lower common denominator we need to look for in terms of disinfectants?
Right. So the hand sanitizer is about 60% alcohol is what you need for the hand sanitizer. Most of them are 70%, so that's great. Disinfectants, I'm a bleach person, just that'll work. And then usually, I mean, all the other ones, Clorox, then, you know, you have the Lysol sprays. I know a lot of those are hard to find now. Just look and see what the ingredient list is, because they should list it and they should tell you if it has viral activity or not.
Yeah, in my former career, I was in the food service. And so, of course, cleanliness is godliness when it comes to the food service. And so we used bleach quite often and used a mix of 1 part bleach, 10 parts water. And that will kill just about everything.
Mm-hmm.
So, and that's something that most people have, bleach in the house. So if you can't find the Lysol spray, you can't find the wipes, you can't find the hand sanitizer, you know, to clean your surfaces, that's something that's real easy to use. Got a question about masks. What is the best type of mask to wear? What's going to be our best protection for wearing?
Well, N95s, but those are not available.
Right.
So there's a lot of good data for what we're using in the medical field because we're exposed a lot to a whole bunch of people. And we know reusing them is not good because we've seen healthcare professionals die from reusing medical equipment. The best data is in N95s. When you're in a hospital, you actually get tested to see if they fit. And so that's why they're also not recommended for like general use for that reason. And also there's a shortage. So they're just like not available. The other best one that we always use for respiratory viruses is just the good old surgical mask. This has good data. And then this is more, especially when you're in a healthcare setting, you're also protecting yourself from other people. If everybody wears a mask, no matter what it is, the risk of transmission is so low because you're catching all the droplets that you're speaking into that mask and they're not becoming airborne. And so honestly, it's just a matter of everybody wearing a type of mask to cover their nose. That's the key, covering your nose and your mouth. None of the half coverings.
Right, and I know those surgical masks, I've seen them at the dollar stores, and so you know you can pick those up pretty much just anywhere.
Yeah.
Now, for like the cloth mask that a lot of us have, are we still wanting?
I wear cloth masks sometimes when I'm at work right now. I wear the surgical mask, but usually I'll wear either. And when I'm out and about, I'll wear surgical masks or cloth masks.
So for the cloth mask, are we still looking at the 3-ply? Is that our best bet there?
Not 100% sure, but I think the data is on the 3-ply. I know there's a lot of masks where you can insert a filter, and that's probably really good too.
Yeah, and I've also heard that you could use just a regular coffee filter as the insert in it, and that's something that a lot of us have, and that is easy to remove and replace, and that helps keep it clean. Speaking of cloth masks, how often should we clean them?
Because this is a dirty area, we probably should not be reusing them every day. You should have a stock of them by now at this point in the pandemic and just have a new one every day. And it's not just necessarily that it's going to be super infected because you're talking into it all day, but I mean, the outside could potentially be contaminated because you're coming in contact with other people. There's a lot of other germs in our mouth. And so a lot of people have had issues with acne and lesions on their faces. And so if you want to minimize that risk, I would just use a new mask every day.
That's a great idea. Now, another question, when we're at the restaurants, and we take our mask off to eat, what should we do with our mask? We don't want to just lay them flat on the table because we're not sure that the table's absolutely clean.
I don't know. I put it back in my bag. But I will admit I have not really eaten inside a restaurant. So there's a risk.
Yeah, it's having been in isolation since March, it's really hard not to want to go out and be around other people. Human beings are social creatures. We want to be around other people. And that's another issue coming with isolation. We already knew that isolation was at epidemic levels here in the United States, and the CDC considers it one of the biggest issues leading to cognitive issues in older adults. That it can really spur those. Any thoughts on things that we can do to help us with our mental health going through this? Because if we're looking at another big uptick coming in November, December, with the potential of more lockdowns coming back around, because if the numbers go back up, then we're going to start shutting things back down again. And, this has been hard on everybody. Let's just admit it. This has not been fun. But we will get through it. We've gone through worse things than this. But when you're in the middle of it and you're missing the kids, you're missing the family, you're missing your grandkids, especially for folks who live by themselves, what are some good ways for us to keep our wits about us?
Yeah, that's hard, right? The rates of depression and anxiety have gone up significantly since kind of social isolation. So we're all well aware of that. You know, I know we can't be around people, and that's kind of what we need. But maybe, some people have been doing this thing where they just kind of hang out with one person and then or a couple people, and then that group of people agree not to hang out with anybody else and to do things that would kind of increase your exposure. So maybe you do something like that. Getting out in nature, that is very good for our mental health. Exercising, yoga, Pilates, things that kind of get our mind off the, hey, I'm alone and this kind of pandemic isn't ending. So I think those are probably the main things you could do. I do think there are a lot of mental health resources out there that probably could potentially clue you into other ideas and things you can do. I've been reading a lot more personally. And because I haven't been doing things, and I've been working out more and cooking a lot more. So those are kind of how I've been mitigating it myself.
Yeah, it's a great time to learn that new hobby that you wanted to learn, and it's exactly going out in nature. I think that is such a great opportunity. The weather is cooler now. Put on your mask, go out to the park, walk around. Look at the trees, look at the flowers. It's a great time to be outside. Quick question on that. Should we wear our masks when we are outside and when we're exercising?
So you should if you cannot socially distance.
Okay. We hear both sides of it. And so our rule of thumb is social distance if you can't put on the mask. Great. Got a question that says, since some of us who live alone have not touched or been touched by another person for 7 or 8 months, is there a safe way to touch or hug another person?
I mean, if you wear your mask and then you wash your hands afterward, the risk is probably very low. So if you want to hug somebody and everyone's wearing a mask, or you want to shake hands, although I haven't been shaking hands, hand sanitizer, just wash your hands. It's just down to basic, like, how do we protect ourselves from viruses?
And again, your own personal risk factors. Yeah, if you have a lot of these other risk factors that you reviewed, like obesity, high blood pressure, diabetes, other things that already put you at risk of developing any disease issue, any viral issue that's out there, you want to be doubly safe.
Yeah, and if you know that person that you want to hug has also been very safe, the risk is probably even lower. But if somebody has been out partying and at bars and spending a lot of time in restaurants or in big groups, there's going to be more of a risk there.
Right. I know that there's a lot of unknowns when it comes to the vaccine, and that we've got ones that are in trial, some trials that have stopped. Best guess is that it's probably going to be sometime next year before we have a vaccine available.
That's what we think.
Because
part of it is mass production. And so even if we know maybe we get something that we know is efficacious and safe before then, you got to mass produce it.
Right. And then once it's mass produced, it's how do we get it to each community? Who's going to give that vaccine? Who gets the vaccine first?
Yep.
How quickly can we continue to mass produce it? Because we're talking about millions and millions and millions of people who will need it in the United States. Right. I know that the ones that are showing the most promise are a 2-step vaccine. Is that still the case?
That may ultimately be the case. If you think about it too, and what we know about our immunity for COVID-19, and we know that our immunity wanes. So that's going to be the big question with the vaccine, is how long does the vaccine last, right? If we're already thinking our immunity for natural disease is about 3 months, you wonder. And so that's the information we don't have. But I imagine we'll have that as post-marketing data, to be honest. That's not going to be information we have going into mass-produced vaccines.
So probably our best guess scenario with everything we know and don't know right now is we're looking at late spring, early summer, potentially, before we have a vaccine that's available here in Central Texas. Okay. So in the meantime, our big takeaways are get your flu shot today if you have not done it.
Yeah.
Go to Baylor Scott & White and get your flu shot.
They have a drive-through flu clinic, actually, and I'll send you that flyer, Rob.
Excellent.
Yeah, you have it. It's on October 17th, so then you don't even have to get out of your car. You can just get a shot.
Fantastic. We will make sure that we send that to everybody who's on the call so that you get that flyer. So we'll make sure that you have that. Number 2, wear your mask.
Mm-hmm.
You know, that's the one thing we know that's proven that works.
Yeah.
Use it. Wear the mask. And then number 3 is work on the things you can work on now. Exercise. You know, spend time on Zoom calls with friends. So at least you're still having that one-on-one with folks, but protect yourself because we are most likely going to be seeing the numbers go up again just because that's the way things work. And so we may be going into need to protect ourselves again. Got one more quick question here that says, I've heard that if you wear a mask along with a face shield, that the two combined is one of your best bets.
Yes, we do think face shields, but you have to wear the mask. So that's the key. Is what you're trying to do is prevent droplets from getting in your eyes. And then one other person asked this question, once a person is vaccinated, how long does it take for it to be effective? And so the general rule of thumb for all vaccines is about 2 weeks for antibodies to develop. We don't have the information for this vaccine because we don't know, but the general rule of thumb is 2 weeks.
Okay. And like you said, that because there's still so much we don't know, but based on what we know about other viruses and how vaccines function with those, there's potential that when the vaccine becomes available, we may have to go back 3 months later with the booster.
Yeah, we'll find out. I mean, honestly, we'll find out. We're all learning as we go here. So.
Yeah. You know, I appreciate so much you joining us today because you've got such a great wealth of knowledge on viruses in general and infectious disease. And so there's so much that we still don't know, but we can apply what we know about other viruses and how we think things are going to flow with this one. But, there's still a lot we're learning, but we do know, wear your mask, social distance, take care of yourself, protect yourself.
Yeah.
So, and get your flu shot. So, Dr. Theoctisto, we thank you so much for joining us today. I know that you have patients that you need to go see. And so we appreciate you for taking your time out of your practice to visit with us today. And we appreciate you at home for joining us today because, again, we want to bring you as much information as we can because this is a difficult time for all of us. But, it's going to be over soon enough. And we just persevere and we'll get through it all together. Tomorrow, we're going to talk about brain health and we're going to talk about whether or not early memory loss is a normal part of aging. Spoiler alert, it's not. And we're going to talk about how you can keep your brain healthy. And then on Friday, we're going to talk about all of the legal issues that we need to know about as we age. So Dr. Theoctisto, once again, thank you for joining us. For all of those of you at home, thank you for joining us. We'll see you again tomorrow morning at 10 o'clock for our session number 3 of the Pflugerville Seniors Conference. Have a great day.
Thank you.